This is just one of those in-between videos. As most of you know, I had a brain aneurysm and had surgery done in February. This is actually to talk about pain meds. I'm on pain meds right at this moment and really not liking it at all. Over the period of time that I've had my brain aneurysm, I think I've been on pretty well everything, and I don't think there's too much that has really agreed with me. I've had endone and Temgesic and you name it, I've had it. I can't really give any good creds to anything because it just knocks me around so badly. At the moment, I've been having some spot pain where my brain aneurysm coiling and stent is, and it went away for quite some time, but I've had it back recently, and I've also been struggling really badly, and this is like 6.5 months now, with tummy pain from the aspirin and blood thinners Plavix, which upset my duodenum and my tummy, causing gastritis and duodenitis. I've had problems with my throat and esophagus as well because of it. Been gradually getting things under control with diet and a few other things, but this last week and a half now I've been back on the road of having quite severe pain in the tummy. So, if it wasn't for that, I think my brain would be working really well by now. Well, pretty well anyway. So at the moment I'm on these fentanyl patches, which I'm on the lowest of lows, and when I was getting onto these earlier, it's 24 hours now, I can't say that I felt any different. And then about 12 hours I started to have a lot less pain, and I felt pretty reasonable. About 2 hours ago, so that's around about, 9 hours maybe, no, longer, would have to be, 16 hours, I found that I started to feel not so great. I've started to have really very, very bad nausea, and feel like a pressure in my head as well. I'm a little bit worried that these don't agree with coils and stents. Not sure what to do. The patch is on for 3 days. This is only day 1 and I'm already feeling really terrible, and apparently this drug builds up in the system. So I'm a little bit edgy, anxious, I guess, about this. I've never had it before. Definitely great for pain, but not so great for making you feel that well. I feel like I'm pale as well, and my throat, obviously I'm getting dried out, as most opioids do to you. But yeah, this is a little bit worrying because it's sort of stuck on my arm and it's here for 3 days. So if I'm already feeling like this within the first 24 hours, I'm a little bit worried that, I'm going to get a lot sicker. So I'm not sure what to do. I'm seeking advice at the moment as to, whether this is a bad side effect. Should I act upon it, or should I just persevere and just go with it? I'm starting to feel quite edgy as well. Just generally, like climb the wall sort of stuff. So I'm not really thinking it's a great drug generally for well-being. Great for pain, but not liking this at all. So for those of you who are thinking about trying fentanyl, look, if you need it, it's going to work for your pain, but I don't know about the side effects, whether the side effects are really worth feeling this way. I think I don't want the pain, but I don't want to feel this like this. And it's also starting to impact my thinking. I feel slower, much slower, and I know that my eyes are starting to look really terrible as well. So anyway, just really talking about fentanyl, and I find these doctors just dish out so many heavy duty medications without really looking into individual patients' needs or issues. I mean, I've always been a low tolerance sort of person for high, heavy drugs of any kind, and they usually do start to cause my heart to accelerate. I get a little bit of an arrhythmia problem, as I do have a heart murmur, which is a congenital condition. So I just don't know. I'm not really sure about using these 3-day patches and anything. I mean, I'm having a 25, I think it's MUG, I think they call it. That's the lowest of lowest doses you can have, and it's not doing me real good generally. All right, so be cautious with drugs that you're taking. As I said, as of the start of all this, I have not found anything in the meds that do me justice or help me. Maybe they do help with the pain a bit, but the side effects and the after effects and the withdrawals are horrific. I had no idea that fentanyl was even an opioid. It wasn't explained to me. So if I had have known that, I probably would not have actually placed this on my arm at all. But anyway, consider what you're taking. Double check. I've made the mistake of not double checking on this before, actually putting it onto my arm. And I normally do, so I'm really quite angry with myself. But I think I may need to get a doctor's opinion. See how it goes, I guess. Anyway, be careful, be cautious. Not sure about fentanyl. Bye.